So what is the problem of bullying? Well, we know it's a national and international problem. It transcends national boundaries, and there's research that's happening all over the world now, and we're very much reminded that it does strongly linked with serious mental illness, both during adolescence but also into adulthood. We also know that technology is playing a much larger role in our everyday lives, and young people, adolescents in particular, are taking this opportunity to use this technology quite rapidly. And so with this use, there also comes a risk of inappropriate use. And so cyberbullying is now a new concern. We also know that targeting bullying is going to really help us to reduce mental illness in the population, and the school community and school settings are a really good way to be able to do that. So here's a bit of a snapshot of the mental health of Australia. This is some data from the 2007 National Survey of Mental Health and Wellbeing. Over 8,000 people. We found here that the researchers found that the 12-month prevalence of mental disorders was highest in the age group 16 to 24. So now here's some data on youth mental illness in Australia. This was the first survey of youth mental health, which was conducted in the late 90s, 4,500 young people. And Sawyer found that approximately 14% of young people had a diagnosis of mental health problem. Another recent report estimated that 20% of the young people surveyed 15 to 19 had probable serious mental illness. And quite astonishingly, almost just over a third of those people indicated major concerns about bullying or emotional abuse. This study here is just hot off the press. It was only released about 2 weeks ago. This is the second Australian survey of youth mental health. And again, the researchers found that approximately 14% of young people aged 4 to 17 have had a mental disorder within the past 12 months. So what does the international literature say? Well, mental health problems, they affect 10 to 20% of children and adolescents worldwide. This kind of matches the results that I just shared with you from Australia. We know it's the leading cause of health-related disability for this age group. Astonishingly, we know that approximately 50% of mental health disorders onset by mid-teens, and 70% of the 75% by mid-20s. So let's now take a bit more of a public health perspective or a population level perspective. We can't rely on specialists alone, mental health services to provide care for all those who are experiencing problems. So we need to take a different approach, an alternative approach, and think more about prevention and early intervention for young people. So we're thinking, well, can bullying be a risk factor that we can target in order to reduce mental illness at the population level? And we argue that bullying is a modifiable risk factor, something that can actually be changed. And we can do this quite systematically in Australian schools. So when we're thinking about risk factors and identifying risk factors that we can provide prevention around, we need to think about these really key questions. Is it something that can be defined? Is it something that's actually prevalent in the population? Does it lead to harm? Can we actually measure it so that we can see if we can reduce it? And is it actually modifiable? Before I go into that, I just want to be really clear about what we're talking about when we talk about the topic of bullying. It's a word that gets thrown around sometimes quite loosely, but this is what we're talking about here. So negative actions that are intentional and repetitive, and they involve a power imbalance between the people or the person involved, the victim and the perpetrator. So there's these three key criteria, if you like, to identifying bullying behaviour: intention, repetition, and a power imbalance. So bullying is not single episodes of dislike or rejection. It's not single episodes of meanness or nastiness or random acts of aggression. And we're not talking about mutual arguments or disagreements or fights between young people. These are quite common. This is a totally separate behaviour we're talking about. So bullying can occur in multiple different domains. Typically, we kind of conceptualise these as physical behaviours, verbal behaviours, social behaviours, and then cyber behaviours as well. So incidents that are happening online, so through the use of the internet or mobile phones. So we termed the former there traditional bullying. So this is what's happening face-to-face as opposed to cyberbullying that can be quite remote and the person can conceal their identity and be anonymous. Traditional bullying obviously occurs at school or within a school setting. Cyberbullying can happen at school, but it can also permeate into the home as well and have a potentially larger audience. So when we think about people's involvement in bullying, we typically think about the person on the receiving end of the negative action, so the person being victimised, but also the person perpetrating the behaviour. And then in the middle, there's this kind of overlap where someone might be victimised in one setting, but they're perpetrating behaviours in another. And this is the group of students or young people that we're particularly concerned about because they have the most serious, it's most strongly associated with more serious mental health issues. So what's the prevalence of bullying in Australia? This has been estimated quite a number of times over the past 15 or so years. So this was one of the first studies in 1999, which estimated about 12.7% of young people reported being bullied in the last school term. Another more recent study found approximately 9% of young people have been bullied often, and most of this bullying was occurring at school rather than outside of school. This was in 2006. One of the most famous studies in Australia now was the Australian Covert Bullying Prevalence Study, which was conducted in Western Australia. It was a huge undertaking, and the researchers found that approximately 26.7% of young people have been bullied every few weeks or more. And you can see the stats there for covert forms of bullying, so the types of actions that aren't quite obvious, so rumour spreading or exclusion. And then, of course, cyberbullying. And almost 9% of young people admitted to perpetrating this behaviour as well. So I'm going to now just present to you a recent study that our group has published on bullying victimisation, so being on the receiving end, and looking at the association with mental health. So we examined bullying frequency, the emotional response, so how upset somebody was by that experience, as well as the form that behaviour took. And we wanted to see which had the most strong association with mental health measures. So we looked at name-calling, physical threats, rumour spreading and social exclusion. Unfortunately, we don't have any data on cyberbullying because this data was collected prior to any questionnaires being developed. So we used the Victorian Adolescent Health and Wellbeing Survey, which was a survey of over 10,000 young people that was collected in 2010. Overall, we found that name-calling was the behaviour that had the highest prevalence, over 25% there. So we found that each form of bullying was associated with psychological distress and poor emotional well-being. But in particular, we found that those students who reported social exclusion, they had the strongest association with poor mental health. We then wanted to have a look at how upset a young person was by what happened to them, and again, see how what the relationship with mental health was there as well. And for all forms of bullying, being upset was consistently associated with poorer mental health, which makes intuitive sense. But again, social exclusion, even if the young person didn't say that it was immediately upsetting, this was still significantly associated with the mental health measures. So moving along, that study that I just presented was a cross-sectional study. So this just gave us a snapshot of these young people at one point in time. The research that I'm going to present now is what we call a meta-analysis. So we've gone into the international research literature and we've aimed to summarise what's going on across the world and what have other researchers found, and collect them all in together and draw some conclusions on what's going on overall. So we screened over 2,000 papers that looked at bullying and some kind of outcome, negative outcome. 149 manuscripts were read in full, and then we analysed just under 100 or so of those manuscripts, and we found these mental health outcomes were quite present. So I'm going to present to you the data on depression and suicide attempts in this meta-analysis, so a collection of studies that have looked at these outcomes. So this is a bit of a scary slide, but all we really need to take away from this is that on the left-hand side, there we go, are all the studies that were included in this analysis, and we found that bullying was associated with threefold the risk of later developing depression compared to those students who hadn't experienced bullying. We then looked at those students who had reported sometimes being bullied and looked at the relationship with suicide attempts. We found that almost 2 times the odds of going on to attempt suicide. When the bullying was more frequent, that increased quite a lot to almost 4 times the odds. What I now want to move on to now is looking at what's the relationship between bullying and later educational or employment opportunities down the track. So this next paper, we used some data from Western Australian birth cohort. So this was a large cohort of offspring that have been followed up at 1, 2, 3, 5. You can read all of the different years that the researchers followed them up. We were particularly interested in their data at 14, in which we asked them, have you been bullied? And then we used the data from 17 and 20 years to find out what were their later educational and employment outcomes. So in this sample, we found that approximately 10% of students reported being victims of bullying, 20% perpetrators, and again, this overlapping group, approximately 8.7% were victim perpetrators. 60% weren't involved in any form of bullying, so they're our comparison group. So this data here is on looking at the completion of secondary school. So the significant results here were for people who reported perpetrating bullying and also victim perpetrators. These groups were less likely to complete secondary school. Here we're looking at their education and employment at 17 years. The one that was significant was for victim perpetrators. These young people were more likely to be in the not in education, employment or training group. Researchers call this group of students the NEET group. So they've dropped out of school and they're not in any form of apprenticeship, traineeship, going to university or in a job. And then we looked at this same analysis again at 20 years. And here we found that those who were perpetrating bullying at 14 years and those who were victim perpetrators were more likely to be again in this NEET group at 20 years. So where are we now? Well, the research on bullying has been going on for approximately 30, 40 years now, but we've really picked up some momentum, particularly in the last 10 or so years. We know that bullying is a significant risk factor to mental illness and poor educational and employment outcomes, as I've shared with you today. We also know that cyberbullying doesn't occur alone. It goes hand in hand and co-occurs with what's happening in the school environment as well. There's this really strong need to develop a targeted and measured approach to dealing with and responding to bullying behaviours in schools and in turn, hopefully improve young people's mental health. So an important part of bullying research is how we measure bullying, and we wrote this paper here, a review paper looking at how best to measure bullying, and we know that it's best to ask young people themselves using self-report instruments that are anonymous. And that way we can use these instruments to do pre and post evaluations of how well we're going with our intervention work. And currently there's no robust measurement tool, something that we can actually rely and trust upon, that measures traditional bullying as well as cyberbullying. So that's what we're doing at the moment. We're conducting an in-school survey with over 1,000 young people just here in the southeast Queensland corner. And we're measuring traditional and cyberbullying. I've been going around to lots of different schools, talking to young people and asking them to fill out my survey. So we're piloting this in schools, and we're going to be validating that tool. And then once it's published and we're happy with it, then we're going to let schools use this as a free tool for them to monitor bullying and cyberbullying in their school communities. So now I'm going to move on to talking about intervention work, and this man here, named Olveus, he is a Norwegian man who really he's the kind of founding father of this area of research, and he, in the 90s, developed a really fantastic intervention program that was rolled out in Norway, and he found that they could reduce bullying by 50%, which is quite amazing. So they consider the kind of gold standard intervention approach to bullying research. The Kiva program in Finland is also another newer prevention program that has been rolled out across the country, and they found that they can reduce bullying by over 20%, which is really amazing. A lot of fantastic work is being done in Australia, but we think that we need to take a more systematic approach and be doing this in every school in Australia, not just little pockets where schools are kind of doing it on their own and don't have much support. So when we think about interventions, we need to think about, well, what's effective? And there's lots of proactive ways that bullying can be prevented, and lots of reactive ways to dealing with bullying when it occurs. So the balance really needs to be in the proactive side rather than the reactive side. So the research would say that school-based interventions that take a whole school approach, that involve parents, that involve teachers, that involve students in the whole process, and everybody owns this issue and understands that we need to work together to reduce it, that's what's going to be the most effective in the long run. So I return to this slide that I presented earlier, and I think I've now presented that this topic can be defined, bullying can be defined, it is really prevalent in the population. It does lead directly to harm that is avoidable, and we can measure it in order to reduce it. So I just thought I'd pop up a bit of an online resource. This is one of the government sites. It's called bullyingnoway.gov.au, which is a really excellent tool for parents, teachers, and young people themselves to go and find out some more information about bullying and how to respond appropriately to a situation that they might find themselves in. So just a few conclusions here now. We know that bullying is a prevalent problem, and we know that at least 1 in 10 young people experience bullying in a given school term. We know that there's this overlap between traditional bullying and cyberbullying. We know it's acceptable to measure, and we know it can be modified through interventions such as those that have been done internationally. We know that it's strongly associated and independently causative of mental disorder. Overseas experiences would say that it is possible to reduce bullying, and Australia needs to try and adopt these methods and apply them to the Australian setting. Reducing bullying will improve the mental health of young Australians. I'd just like to make some acknowledgements. So I don't do this work alone. I have 2 really fantastic supervisors, James Scott and Jason Connor at the University of Queensland. We have some collaborators on the large data sets that I presented, and I'm generously supported by Clear Thinking, Professor Stan Katz at UQ, and the Bryan Foundation, as well as the Australian Federation for Graduate Women. So thank you.